What's up, guys? Hey, Jared Beckstrand here, Doctor of Physical Therapy, TonandTitan.com, and today I wanted to share with you 4 of my favorite exercises to help you to eliminate your low back disc pain. Now, these are things that I share with patients all the time. They are incredibly effective, and I hope that they help you guys out as well. Of course, if they do, leave the video a thumbs up and leave me a comment down below. Let me know your experience with it. I would love to hear that from you. Now, before I jump right into the exercises, give me 2 minutes to explain a little bit of the anatomy behind this so that you can understand why these exercises are going to be effective for you. Now, if we look at our spine, it's a series of vertebrae, those are the white parts, stacked on top of each other, and they're interspersed, or between each one of those you have a disc. That's kind of this gray part right here. So I've drawn that up on the board. Now, your discs are made up of 2 materials. There's an outer layer that is made up of tough cartilage, a series of layers of tough cartilage, and then there's an inner layer that is more fluid in nature, a little bit more kind of jelly in nature, if you will. Now, in a normal arrangement, everything is smooth and symmetrical, and everything is healthy, and everything looks good. However, what can happen over time is with certain postures and positions and activities, that outer layer can develop areas of weakness in it. And what can happen is we bend, we lift, we twist, we do something just right, and that can put pressure on that disc that causes this inner material to squirt to the outside, and it causes it to bulge or herniate, kind of more of that arrangement right there. Now, the analogy that we draw as physical therapists is it's like a jelly donut or maybe a water balloon. If I had a jelly donut between my hands, and if I put pressure on the front of it and push down, that jelly is going to squish out the back. Same thing happens with your back and with your discs. Here's my disc. If I bend forward and if I lift or twist or do something just right, that's essentially putting pressure on the front that causes that disc material to bulge out to the side or out to the back. Now, you can see on my spine model right here, this poor individual has a disc bulge right there, that red part that you can see. Now, the pain that you feel with the disc bulge comes from these yellow nerve roots right here. So you've got the nerve roots that come down and they exit your spine at each spinal level. What happens is if that disc bulge butts up against that nerve root and impinges on that nerve root, that is what causes pain in your back. That's what causes pain, numbness, tingling down your legs. It's that pressure on that nerve root. And so our goal in physical therapy, and your goal at home, and my goal with this video, is to alleviate the pressure that's on that disc to help some of this fluid material that's bulging out to relocate back to the middle. And if we can do that to the point where it's no longer pressing on that nerve root, that's going to help you to feel much better. And so that being said, let me show you 4 of my favorite exercises to help alleviate some of this pressure, to help your disc bulge, and to help you to feel better. Exercise number 1 is going to be lumbar spine traction. Now, traction simply means that we're taking the vertebrae and we're pulling it apart. The goal there is that we take the vertebrae above and we pull it apart from the vertebrae below. What that does is it decompresses the disc, and it also creates a negative pressure in there that's going to help some of that disc material pull back to the middle of the disc. Now, to accomplish this at home, there's a couple of different options that I want to show you. First one is right here on the pull-up bar. Now, obviously, if you don't have a pull-up bar or access to one in the gym, you can actually get them for fairly cheap. If you go on Amazon, I'll leave a link to my favorite one down below. And honestly, the benefit on this is well worth the cost. So just throwing that out there. And so what I'm going to do is just hook both hands up around the pull-up bar and then just hang nice and relaxed. Now, the key here, hopefully you can see it, is that my feet are actually in contact with the ground. If that pull-up bar is too high and if my feet aren't in contact with the ground, what happens is it causes a little too much lat and lower back muscle activation that the traction is not as effective. So keep that in mind. What you're going to do is hang from the bar for just as long as you can. I recommend at least 20 seconds up to a minute, and then maybe take a break and kind of see how it feels. And then you can repeat that 2 or 3 times, and you can actually do that like every hour. Like, you honestly can't get enough traction on your spine if you have this condition going on. And so if you don't have the pull-up bar, or if you don't want to buy the pull-up bar, I've got my door open over here. You can also do this in a door frame. I'm just going to hook my hands on the top of my molding up here, and then it's just the exact same thing. I'm just going to kind of hang from that, keep your feet on the ground, and just try to stay nice and relaxed in your back. Now, if neither of those options work for you, I'll show you one more option right now, and that's flopped over the edge of your bed. And what you're going to do is lay your torso down on the bed, but then keep your hips and your back off of the bed. And what will happen is the weight of your torso is supported, but the weight of your hips and your legs kind of pulls your back and creates this traction force. What you should feel is this traction force in your back that decompresses those discs and hopefully helps you on the path to feeling better. Exercise number 2 is for those of you who walk around like this. If you don't necessarily have a sideways lean or a sideways tilt, you don't necessarily need to do this exercise. However, if you look in the mirror and say, why am I always leaning to one side? Why does my back hurt? And why am I always leaning one direction? This one could help you guys out. Oftentimes what happens is if that disc bulge, let's say it bulges in this direction, so that disc is bulging out to my right over in this way, you're going to lean away from that because that feels more comfortable. Now, for the reasons that I just stated in the intro, we don't want this. We want to get that disc material this way back into the middle. So to do that, we actually need to lean to the right, close down that right side to push the disc material back to where it needs to be. The exercise that I like to do for that takes place right here in the door frame. So again, if I'm leaning this way, what I need to do is close down this side. And so I'm going to get just my elbows in the door frame. Now to close down that right side, I'm just going to try to push my hip over to that left side of the door frame. I'm going to take that as far as I can comfortably, hold for just 2 or 3 seconds, come right back out of it. And what you should find is the first, 1 or 2 reps of this might be a little uncomfortable, but as that loosens up, you should find that you can start to push further and further into this direction. After about 10 or so of those, kind of assess how you're feeling, come out of the door frame and say, oh my gosh, hey, that actually does feel better. That's the response that I most typically get. If that's the case, we can do about 10 more repetitions over here to the side. Exercises 3 and 4 are going to be a progression of lower back extension exercises. You'll often hear these referred to as McKenzie exercises as well. The idea here is that the majority of disc bulges happen out the back. So frequently we lean forward, puts pressure on the front of the disc, and causes that bulge to go out the back. The idea now is that if we introduce extension, back bending into this, that puts pressure on the back of the disc that helps that disc material push back into the middle where it should be. Step number 1 is just going to be lying down on your stomach. Well, I'm going to leave that down there. Lying down on your stomach. And you'll see that even in this position, all of a sudden my back starts to extend slightly. Now, some of you might not even be able to tolerate this. If that's the case, we can grab a pillow, put that under the hips, and you can see how that kind of flattens my back out. But the goal would be to progress into more and more extension. So eventually I'm going to get rid of the pillow. The goal is going to be we're even going to get up onto our elbows. You can see that that really increases the curve in my lower back. What I do is I tell people to hang out here for about 10 seconds and then come down here for 10 seconds. Kind of rest, relax, reset the system. We're going to press up onto the elbow again for 10 seconds, hold for 10 seconds, and then come back down. As that starts to feel better, the next step in this progression is to introduce a little bit even of a press with our hands. So my hands are going to come underneath my shoulders, and then I'm going to use my arms to press up in this direction as high as I can comfortably. I would hold that for 10 seconds and then come down. But what you should see is that as you do this and as you push and hold and push and hold and push and hold, you're actually able to get up higher and higher as that disc material centralizes. Now, the biggest problem that I see with this one is as you're pushing into extension, I want you to keep your hips on the table. So for example, if you come to here and think, I can push a little higher, and you come up here, all of a sudden you're defeating what we're trying to accomplish. We're trying to keep the hips down, push up as high as you can until we get some good extension into our lower back. Eventually, we want to be all the way up here, and that's where I'd have you hang out for 10 seconds at a time. Again, pay attention to how your back feels while you do that exercise, and keep it in a in more or less a comfortable range as you do that. Don't try to push it all at once, but it's something that you progress up into. Now, exercise number 4, as you become increasingly tolerant to that exercise and to that activity, that you can actually progress into a standing position. So exercise number 4 would be a standing back extension. What I like to do with my hands is put my hands right at my lower back, kind of press in that way, and then what you can do is just bend over backwards, hold that for about a 5 to 10 second count, and then come right back up out of it. So it looks like this, hold for 5 to 10 seconds, and come out of it. So the idea would be to take the prone progression from the table up into standing as you can tolerate it. And so you guys, I hope that helps you out. Again, if it does, leave me a thumbs up, leave me any questions or comments that you might have down below. If you have more questions or if you'd like to know more information about sciatica, about low back discs, about nerve pain, about things of that nature, check out these videos right here. That's really going to help you guys out. If you haven't subscribed to Tone and Tighten yet, hit this circle button right here. That will subscribe you to the channel so you never miss a new video from me. That's it for me, you guys. We'll see you next time on Tone and Tighten.